Today's topic is carpal tunnel syndrome. Carpal tunnel syndrome is a very common problem, and many of you may be noticing that you are having pain in your hand, numbness, decreased sensation, or weakness in the hand movements, and it can be because of carpal tunnel syndrome. So basically, why this happens? In our wrist, there is a small tunnel from where the median nerve passes, which supplies most of your fingers. And when pressure is increased in this tunnel due to any reason, then it causes pressure on your nerve and it leads to symptoms like pain, numbness or tingling or a decreased sensation, and sometimes in advanced stages weakness of your muscles and movements. So let's see who are the people who are most suffering from this problem. This problem is very uncommon below the age of 20 years and it occurs more often as people age. This problem may occur in females who are around their pregnancy time because of hormonal changes. It also occurs commonly in people who are diabetic, consume alcohol, who had problems like arthritis, or sometimes they had some wrist injury, fracture, dislocation, or if they are having small cyst or tumor in their wrist area. This again can compress the tunnel and increase the pressure on median nerve. So when you are having such problem and when you consult your doctor, how he will proceed? First, he will examine you clinically and he will determine if your symptoms fit into the category of carpal tunnel syndrome or they are because of some other reason like problem in your nerves, the level of shoulder, or in the in neck. There are problems which are causing compression on your nerve. And once he is sure that it is more likely because of carpal tunnel syndrome, he may advise you for advanced tests such as EMG or NCD, that is nerve conduction studies. That will give you the diagnosis if it is because of carpal tunnel syndrome. And if it is because of carpal tunnel syndrome, then treatment is simple. Treatment is divided into two parts. First is non-surgical and other is surgical treatment. In non-surgical treatment, the first thing is splinting of your hand. The hand is given a splint so that the extreme wrist movement are limited and you get relief in symptoms. The other treatments are medicines to decrease the swelling, and sometimes doctor will prefer to give steroid injection as well in the nerve. Usually these non-surgical treatments are more effective in patients who are having milder form of carpal tunnel syndrome. But in advanced disease, or when these medical treatments are not working, then surgery is an option. But don't worry, surgery is a day-care surgery. That means it is not very prolonged surgery. It is done in few minutes, and your doctor will anesthetize only the part of hand which is to be operated, and you may go back to your home after 1 or 2 hours of surgery. Usually, most of the patients feel relief in their symptoms on the same day of surgery or next in 1 or 2 days. Those who are having severe symptoms may take longer time for improvement in their symptoms. Usually the stitches are removed around 10 to 14 days and most people are able to resume their normal activities around 4 to 6 weeks period time. The recovery after the carpal tunnel syndrome vary from patient to patient. It depends on patient age, their level of activity, their general health, and the exercise protocol they are following. But usually after this surgery, 95% of the patient feel relief in their symptoms and they lead a comfortable life here onwards. So if you are worried about symptoms like pain, numbness, tingling, weakness in your hands, or difficulty in operating laptop or doing repetitive wrist movement, you may be suffering from carpal tunnel syndrome. Do consult your doctor or plastic surgeon and get yourself treated. Thank you.